So what is the topic? तो एस्टिमेशन ऑफ, पहले और दो क्या क्या किया था हम लोगों ने? हाँ. So in introduction, a healthy human adult degrades 160 to 200 gram of protein, mostly from muscle, daily to yield amino acids. 75 to 80% of these amino acids are reutilized for protein synthesis. The remaining is catabolized in the liver, releasing 5 to 15 gram of nitrogen in the form of ammonia. Ammonia is toxic and is converted to urea. Urea is a non-protein nitrogen containing compound which forms 55 to 90% of urine nitrogen and is synthesized in the liver. Through the urea cycle, which is also called as the Krebs-Henselt cycle. Urea thus produced is excreted in urine. It passes freely through the glomeruli so that its concentration in the glomerular filtrate is the same as in the plasma, which is 15 to 40 mg per deciliter. 40 to 70% of urea via passive diffusion is reabsorbed in the tubules along with water, but its concentration in the urine is higher than that's in plasma because water is reabsorbed to a much greater extent. Since it is reabsorbed, urea level in plasma and urine cannot be used to calculate glomerular filtration rate. Clearance is also dependent on non-renal variables like diet and hepatic synthesis. So this is the urea cycle. Okay, ammonia with ammonia and carbon dioxide, then converted to carbamoyl phosphate with help of enzyme carbamoyl phosphate synthetase 1. So this is the rate limiting step. Then carbamoyl phosphate to citrulline to arginosuccinate, then to arginine to ornithine. So this is also called as ornithine cycle also. Ornithine cycle. So metabolic disorders of urea cycle may occur due to defect in any one of the enzymes catalyzing the 5 steps of urea cycle. As a result, the precursor accumulates and these disorders are named according to the precursor which rises in the blood. There are 5 steps in urea cycle. So this sky color portion and the pink color portion, the sky color portion is happening in the cytoplasm and the pink color portion happening is the mitochondrial cell of the liver cell. So these are the various methods used for the determination of urea. No need to write in details. Okay. So there are three methods. First one is enzymatic methods, and under enzymatic methods are Nessler's method, Barthelot method, and the kinetic assay using glutamate dehydrogenase. What we are performing is Barthelot method. So write this point only. The Barthelot method you can write in details. The rest too, just write the name. In Nessler method, ammonia reacts with potassium mercuric iodide, which is Nessler's reagent, to form yellow color, which is measured at 480 nanometer. In Barthelot method, this method is based on measurement of urea in serum by urease enzyme. Urease reacts with urea and liberates ammonia, which further reacts with phenolic chromosine and hypochlorite to form blue-green color complex, which is indophenol. The intensity of color is measured at 570 nanometer. So urea with water then reacts with in presence of urease enzyme, it's converted to ammonia and carbon dioxide. Then ammonia reacts with phenolic chromosine plus hypochlorite, gives to blue-green colored complex indophenol. Then kinetic assay using glutamate dehydrogenase. Ammonia reacts with alpha ketoglutarate in presence of glutamate dehydrogenase and NADH. This results in the formation of L-glutamate and NAD plus rate of decrease in concentration of NADH is measured at 340 nanometer. In Barthelot's method, the measured intensity of measurement is 570. But in our colorimeter we have 540. Yes. We don't have 570. So we will measure at 540 nanometer. The second is non-enzymatic method, diacetyl monoxime, DEM method. And third one is bedside measurement of blood urea by azo stick. The sample required for bedside measurement is whole blood. So what is DEM method? The principle of DEM method is urea reacts with diacetyl monoxide in the presence of thiazemic carbazide and cadmium ions under acidic condition to form a rose purple diazine derivative. The intensity of the color is measured colorimetrically. This method is linear up to 300 mg/cent. For higher values, the blood samples should be diluted. And for azotix, the principle is strip has urease enzyme and bromothiamol blue indicator. Ammonia is released due to action of urease on urea, and this ammonia changes the color of the indicator from yellow to green to blue. So what is the normal range of urea in blood? 15 to 40 milligram per deciliter or per 100 ml. In urine, it is 23 to 30 gram per day. When expressed as burn blood urea nitrogen, it is 7 to 25 milligram per deciliter, and 1 milligram of burn equal to 2.14 milligram of urea. One is urea, another is the nitrogen content and the urea both, blood urea nitrogen. So one burn blood urea nitrogen equal to 2.14 milligram of urea. So both are not same. So what is the procedure? The procedure is, so what is the required wavelength? Ideally 570, but we are doing under 540 nanometer. Pipetting तो सबको आती है ना, micro pipetting, how to do? So in this chart there are L1 and L2, the buffer reagent and enzyme reagent. You write as reconstitute reagent. जो तुम लोगों को दिया जाएगा वो L1 plus L2 का होगा. हाँ, लिखो reconstitute reagent. For reconstitute reagent, no need of blank sample, only for standard and test. Reconstitute reagent, which is L1 and L2, forget it. L1 and L2, forget it. Only write reconstitute reagent. For both test tube, this is 1000 microliter, 1 ml, na? This is 1 ml, this is 1 ml. Reconstitute reagent 1 ml for both test tube, 1000 microliter for both standard and test. Then add standard, this 0.01. 0.01 means how much microliter? 0.01 is 10 microliter. So 0.01 to 10 microliter for standard, you add in one test tube 10 microliter standard and another test tube 10 microliter test. The whatever the sample provided, 10 microliter. First is 1000 microliter, then in test 10 microliter, in standard 10 microliter. Then mix it well and incubate for 5 minutes at 37 degrees Celsius or 10 minutes at room temperature, 25 degrees Celsius. So today we are doing in room temperature because now room temperature is more than 25 degrees Celsius. So no need to incubate. We'll wait for 10 minutes in room temperature, 25 degrees Celsius. Then add chromogen reagent. So remember this now, for winter you have to incubate in 37 degrees Celsius for 5 minutes. When the room temperature is 25 degree or more, then wait for 10 minutes in room temperature. Then add chromogen reagent, 0.2 ml is 200 microliter na? 0.2 ml is 200 microliter. Then add chromogen reagent in both test tube 200 microliter. Again mix well and keep it in room temperature for 10 minutes. 200. The 0.2 is 200. 0.01 is 10. First take 2 test tube. Then what the reagent given, the reconstitute reagent, you have to take 1000 microliter in both test tube for standard. Only that reconstitute reagent. L1 and L2, this 4 is provided in the urea kit. Okay, L1, L2, this urea standard, and so we have to premix it, L1 and L2. This is not needed for you. Okay, you just write reconstitute reagent 1000 microliter. 1000 microliter for both test tube. For test and for standard for both test tube. Then add test sample 10 microliter and standard sample for 10 microliter. Then mix it well and keep it in room temperature for 10 minutes or incubate it at temperature of 37 degrees Celsius. Then again add chromogen reagent 200 microliter in both test tube and again mix it well and keep it in room temperature for 5 minutes or incubate it at 37 degrees Celsius for 5 minutes. No need of buffer. Skip this column. Skip this. So what is the calculation? How to calculate? Urea in milligram per deciliter equal to absolute test by absolute standard into 40. Why 40? Because this is the standard for this provided urea. This is the standard for this urea kit. The urea standard is 40. So you have to only measure the standard and the test. Then test divided by standard into 40. Can you repeat anyone the whole procedure?
First we take 2 test tubes, reconstitute reagent, 1000 ml.
1000 microliter.
1000 microliter, and we take the test and the standard. Test 10 microliter, standard 10 microliter. We will mix it well and keep it at 37 room temperature or incubate it. And again we will add the.
If you incubate, this is for 5 minutes, and then if room temperature, then for 10 minutes. 10 minutes. Yes.
And we will add the chromogen reagent. We will mix it well.
How much?
Chromogen reagent.
200 microliter. 200.
Microliter. And we will again mix it well at 37 degrees centigrade for 10 minutes and if we incubate.
37 degrees Celsius for 5 minutes. Incubate or room temperature 10 minutes. Then calculate it in colorimeter. Then apply this formula, absolute test by absolute standard into 40. Okay. So what are the reasons of the raised blood urea? So first one is physiological variation. The higher in men than women, varies with amount of protein in the diet, low in early pregnancy probably due to hemodilution, and the pathological condition in which urea level is increased is divided in 3 groups. First one is pre-renal, the congestive heart failure. Most important are conditions in which plasma volume or body fluid are reduced. And then shock, severe burn and hemorrhage, diabetic ketoacidosis, dehydration due to vomiting and diarrhea, ulcerative colitis with severe chloride ion loss, then pyloric stenosis with severe vomiting, intestinal obstruction, thyrotoxicosis and fever. These are few reasons of pre-renal cause of raised blood urea. Then what are the renal causes? The blood urea can be increased in all form of kidney disease, acute and chronic glomerulonephritis, nephrotic syndrome, malignant nephrosclerosis, chronic pyelonephritis, renal tuberculosis, mercurial poisoning, chronic renal diseases, benign and malignant hypertension, congenital cystic kidneys, diabetic nephropathy and renal vein thrombosis. And what are the post-renal causes? Increase is due to obstruction in the urine flow. This causes retention of urine and so reduces the effective filtration pressure at glomeruli. Enlargement of prostate, stone in urinary tract, stricture of urethra and tumor of bladder affecting the urinary flow or carcinoma bladder, the cancer of bladder. So these are the cause of raised urea. What can be the cause of decreased urea?
Low protein.
That is physiological cause, na? Any pathological cause? Liver? Yes. In liver cirrhosis or cancer of liver. There are some question and answer. What is the normal range of blood urea? Then what is azotemia and uremia? What is azotemia? Azotemia is higher than normal blood level of urea or other nitrogen containing compound. तो ये जो हम बोल रहे हैं ना raised urea, तो this is azotemia. Then what is uremia? When symptoms like lethargy, anorexia, nausea and vomiting, mental disorientation and confusion, muscle twitching, convulsion and coma accompany azotemia. So with raised urea level, if these other symptoms are associated, then this is uremia. So what is the relation between non-protein nitrogen, NPN of blood and burn? So burn equal to blood urea by 2.14. What are the sources of the two nitrogen in urea? Ammonia and aspartate. So this comes from the amino acid pools. Na? So what is clearance? Clearance is defined as the volume of plasma which is cleared of a particular amount of a substrate that is excreted by both the kidneys in 1 minute. The filtration in 1 minute, this is something GFR, na? Filtration in 1 minute. So out of urea and creatinine clearance, which one is better and why? Unlike urea, serum creatinine level is not affected by diet, age, dietary factors or by fluid depletion. The creatinine is filtered but it is not absorbed by the tubules unlike urea. Hence it is better. Like if you take more protein, then your urea level will be more. So this changed very frequently. Unlike this is not creatinine, not like this, not acts like urea. So creatinine is the more standardized parameter for kidney function test. Thank you. The class is finished. This towards same. This is the reagent. This is the standard and this is the chromogen reagent. Okay. इसको 1000 microliter, इसको 10 test sample and इसका 200. Okay.
Ammonia बहुत toxic.
Right.
और नहीं है क्या? तो वो लगाओ उसमें।
Ureotelic.
पास करो।
Aminotelic, uricotelic, ureotelic.
डायरेक्ट अमोनिया को वो
नहीं कर सकते।
कन्वर्ट होता है, यूरिया से यूरिया निकलता है।
हाँ। तीन तरीके का होता है। इसमें तो लिखा है स्टैंडर्ड। हाँ, तो इधर लिखा है SOT लिखा है। इन पे भी लिखा है ऐसा।
चला जाए।